Thank you so much for having me. Thank you to CCRAN, and thank you to the survivors who spoke earlier today. It was really important that we share our stories, and that's how we raise awareness, and that's how we save lives and make a difference. So a big thank you to the survivors that just spoke. So as you said, my name is Kim Newcomer, and I'm the Senior Manager of Community Engagement at the Alliance and Stage 4 Rectal Cancer Survivor. And I'm going to be giving you the survey results from our 2019 Never Too Young survey. So a little bit about the Colorectal Cancer Alliance. Our mission is to empower a nation of allies who will work with us to provide support for patients, families, caregivers, and survivors, raise awareness for preventative measures, and inspire efforts to fund critical research. And our vision is a world free of colorectal cancer. With the mission to support this young onset community, the Colorectal Cancer Alliance launched the annual Never Too Young survey to better understand the critical needs of the young onset population. In 2019, the Alliance's fourth survey was developed, disseminated, and analyzed. This survey addressed a myriad of topics from pre-diagnosis through survivorship, including demographics, community, lifestyle prior to diagnosis, symptoms, knowledge of biomarkers, clinical trials, and quality of life. Of the 885 participants, 41% were survivors and 59% are current patients. 79% were female and 21% male. 59% of respondents indicated that they were diagnosed with colon cancer and 39% with rectal cancer. We had 2% that presented with colon and rectal cancer. The average age at diagnosis was 42, with 28% being diagnosed under the age of 40 years. Our respondents self-identified as 90% white or Caucasian, 4% Hispanic or Latino, 2% African American or Black, and the remainder are Asian, Pacific Islanders, Native Americans, and other races. Most of our responses, 87%, are from the United States, with representation from 7 other countries, including Canada, which had 4% of the demographic. Now we know in young onset, usually hits families when they're starting your family and your employment. So this survey found that 75% of patients and survivors were employed full-time at the time of their diagnosis, but only half of them were working at the time of this survey. And of those who were working full-time at diagnosis, 28% were now currently not working. 1/4 of the respondents had been NED or no evidence of disease for 2 to 10 years. Now this suggests that a significant number of young onset patients were unable to work after their diagnosis. Of those surveyed, 66% took a leave of absence, left their job, or left school due to their diagnosis and treatment. We also asked about lifestyle and habits prior to their diagnosis. 77% of respondents indicated that they were in excellent or good health prior to diagnosis, and 21% reported they were in good health. African American respondents were 4 times more likely than Caucasians to report that they were in poor health prior to their diagnosis. And poor health was not reported by Native Americans and Asian Pacific Islanders. 85% of the respondents reported that they were active or very active prior to their diagnosis of colorectal cancer. So we do know that family history of colorectal cancer increases the risk of being diagnosed with the disease. Nearly 28% of survey respondents indicated that they have a family history of colorectal cancer. Now, this finding is consistent with previous surveys and the scientific literature. 52% of our respondents are aware that their family history increased their risk for colorectal cancer. And 20% of our patients and survivors who do not have a family history were less aware of the increased risk to their family members based on their diagnosis. Now, interestingly, respondents who were aware of their family history of colorectal cancer were diagnosed at earlier stages than those who did not know or did not have a family history of colorectal cancer. We did ask our patients and survivors what their path looked like from symptoms to diagnosis. Now, 14% were aware of the signs and symptoms associated with colorectal cancer. 49% had no knowledge of the signs and symptoms, and 37% were somewhat familiar with colorectal cancer symptoms before their diagnosis. We also asked our patients what symptoms they experienced, what was the most common symptom. So the majority of patients and survivors reported that they experienced multiple symptoms, with 81% experiencing at least 3 different symptoms prior to their diagnosis. And 68% of patients reported that blood in their stool was the first symptom they noticed. It was also the most commonly experienced symptom. So young onset patients also visited multiple physicians prior to their diagnosis. 75% of patients and survivors reported that they saw at least 2 different physicians, and 36% were seen by 3 or more physicians. Approximately 9% of all patients indicated that they were seen by at least 5 different physicians prior to their diagnosis. Our survey participants also reported the need for multiple appointments, regardless of the number of physicians they saw. Of those who only saw one doctor, 44% were seen for the same doctor for multiple visits, and 50% were ultimately diagnosed in the emergency room. As many as 45% of patients and survivors reported that once they sought medical attention, they were diagnosed with colorectal cancer within the first month of seeing their doctor. Another 10% of patients were diagnosed within 2 months of seeing their doctor. However, 7% were diagnosed with colorectal cancer 6 to 12 months after seeing their doctor, and 19% were not diagnosed for more than 12 months. We know that young onset patients often have symptoms for months or years before seeing a medical professional. In this survey, 62% of patients and survivors reported that they waited 3 or more months to visit a medical professional after they noticed their symptoms. And medical providers offered a rectal exam to less than half of the patients and survivors who presented with blood in their stool or rectal bleeding. So then we want to talk a little bit about mistakenly diagnosed conditions. The survey respondents indicated that 54% were misdiagnosed before being diagnosed with colorectal cancer. Of that 54%, 43% were misdiagnosed with hemorrhoids alone or in combination with another condition, with anemia alone or in combination with other conditions, 12% with irritable bowel syndrome alone or with other conditions, and a startling 11% were diagnosed with mental health issues alone or other conditions. Our survey also showed that women were more likely to report that their symptoms and concerns were dismissed by their doctors. So we also asked our patients and survivors if they felt like they were dismissed due to their age. And although many patients felt that their medical providers listened to their concerns, only 40% of patients and survivors expressed that still expressed that their providers dismissed their symptoms and concerns. Younger patients diagnosed between the ages of 19 and 39 were more likely to report their concerns were dismissed by their doctors than patients who were diagnosed between the age of 40 and 50. So really quick, everyone, I have a poll question for one for patients, survivors, and caregivers, and one also for medical professionals. We always seem to have this communication gap when we're talking to our doctors, or maybe there's something we're missing. So I want to ask the patients, survivors, and caregivers, How well do you feel your doctor listens and understands your concerns and preferences? And for medical professionals, I have the poll question. We know a major key to successfully diagnosing your patient is listening and understanding your patient's concerns and preferences. And we want to know, how well do you think you listen to your patient? So I would love for you guys to answer that poll question, and we'll get back to the results at the end. So I'm going to move on to our next slide, which is young onset patients diagnosed in late stages of the disease. Many of our young onset colorectal cancer patients and survivors are diagnosed at later stages. More than 77% of our respondents were diagnosed with stage 3 or stage 4. The survey found that a larger percent of colon cancer patient survivors were diagnosed at stage 4, and most rectal cancers were diagnosed at stage 3. So we also asked about reoccurrences and cancer recurrences and initial stage at diagnosis. So out of the 885 respondents, 24% had at least one reoccurrence. Out of the 24%, 60% had one reoccurrence, 23% had two reoccurrences, and 10% had three reoccurrences. So the remainder had 4 or more reoccurrences, with one person having greater than 10. Of the 24% of patient survivors who reported a reoccurrence, the patient initially was diagnosed at stage 3 and had the most reoccurrences with 43%. And stage 4 had 41%, and stage 2, 10%, and stage 1 had 6%. We also know that patients often report poor quality of life. So we know the psychological impact for young onset colorectal cancer is clear, with 75% of our survey participants sharing that they have been concerned about their mental health, and 64% responding that they've needed help for their depression. A further 25% of the survey participants indicated that mental health concerns are significantly impacting their lives. 95% of respondents said that emotional exhaustion impacted their lives at least some of the time, and more than 50% said it impacted their lives always or often. Despite mental health concerns, which include fear of cancer reoccurrence, more than 95% of survey participants reported they feel satisfied with how they're coping with their illness and are able to enjoy their lives at least some of the time. Around 20% of the same group indicated that they always felt like they were coping with their illness and enjoying life. It is apparent that fatigue can be a debilitating side effect that disrupts daily living and can contribute to emotional distress. So 80% of our survey respondents indicated that they experience fatigue, which impairs their ability to make decisions. 88% said they had to limit their activity due to fatigue, and 90% indicated that their fatigue interferes with their ability to carry out everyday activities. And we also know financial health is a big piece of the puzzle when it comes to young onset. Most people, like I said, are just starting their families, just getting into life, and patient survivors and caregivers did face financial hardships. 71% of patient survivors said that they felt their insurance coverage was adequate for their treatment, and 50% of patients and patient and survivor respondents indicated they feel financially stressed and they're worried about the loss of their family's financial income, as well as the problems they will face in the future because of their illness and treatment. So the survey did have several limitations, including survey respondents did not serve as a holistic representation of those who have been diagnosed with colorectal cancer. It was skewed to the highly informed and engaged colorectal cancer community. Despite these limitations in the population, several important gaps were identified. Young onset colorectal cancer patients are diagnosed at late stages after many visits to medical providers, and misdiagnosis all indicate a knowledge gap, not only in the population, but also with the medical community. The Colorectal Cancer Alliance is dedicated to working with all stakeholders, including policymakers, to address the unmet needs in this unique and often overlooked population of colorectal cancer patients and survivors to improve their outcome. You can find more information on our Never Too Young survey online. We also have a caregiver survey at ccalliance.org. I believe someone's going to put it up in the chat for me. There's also information on our website about the resources we have available. We also have a chat called Blue Hope Nation on Facebook, and a private community called Ally to Ally. And we always have our helpline, which is open Monday through Friday, where we have our patient navigators who are able to navigate patients on their journey with colorectal cancer. So I'm going to go up to the poll really quick. Did anyone? So let's see. So we're asking, I'm going to just review the poll if that's okay. So patients, survivors, and caregivers, I think what the poll result is showing that 37% said sometimes they feel like their doctors listens to them. Let me see what the next one is. And the medical professionals often, 25% often or always feel like they listen to their patient's concern, and we had 50% who preferred not to answer. So exit the poll. And I just want to say a few thank yous. I want to thank our Never Too Young Advisory Board, which is made up of 42 patients, survivors, and caregivers of young onset colorectal cancer. They're an amazing group of people. And if anyone's interested in joining, you can find us on our website as well. I'd love to thank Dr. Porter, Dr. Laura Porter, who is amazing as well. She helped do all the research and put the survey together, along with Dr. Ronit Yarden. So a special thank you to them, and a special thank you to the Colorectal Cancer Research Action Network for letting us provide and present our material and our Never Too Young survey. Thank you.
Thank you, Kim, so very much. That is a lot of very deep information. And we will ensure that we publish all of the links to your surveys, post the conference as well. We're delighted that we've been able to form a wonderful relationship with you. There is a couple of questions that have come in now, if you don't mind spending a moment. One of the questions is, did you find any national differences reflected in the data?
You know, we did not go through the data that way, but that is a great question. I think we're hoping we can partner with a few other organizations to help disseminate our next survey, and that would be really great.
Yeah, I think the basis of your survey really in the Canadian market, I mean, colorectal cancer doesn't know boundaries, that is for sure. I think that the data that you have can be very useful here, and I think that there's a lot of appetite for not just learning together, but sharing information together. Another question we have here, and it's along the same lines outside of national, is if you had to characterize some of the key survey differences of young versus old, is there any comments or insights that you could provide around that?
Young versus old. I think the difference is the younger people who seem to get colorectal cancer are usually diagnosed in the later stages. It's faster growing, it's more aggressive than in people over the age of 50. Here in the US, we just had our guidelines change, so we did drop the screening rate to 45 now. But as we all know at this conference, that may be okay for some, but for like myself and some of the other people, we were all diagnosed at a younger age. So I think being aware of your body and being your own best health advocate really helps. But I think just trying to get that scope or that screening and knowing the symptoms is really important.
Yeah, thank you so much for that. I think this concept of intuition, being your own self-advocate, knowing what's right for you is a key theme that we've seen coming out of some of the patient conversations as well. So thank you so
Right.
much for sharing all of that. We'll ensure that all of your resources are shared, and we look forward to more collaboration with your organization. Thank you.
Thank you so much.
I'm going to move on to our second speaker, who is also from the U.S. And I'd like to introduce you now to Andrea Dwyer, who's an advisor to Fight Cancer, which is a national colorectal survivorship nonprofit in the U.S. Andy's engagement in the colorectal cancer community runs deep. She is the director and founding member of the Colorado Cancer Screening Program at the University of Colorado Cancer Center, as well as a former executive committee member of the National Colorectal Roundtable. Andy will share the extraordinary advocacy work that has been done to support early age onset colorectal cancer in the U.S. Please help me welcome Andy Dwyer.
Thank you all so much. And I want to make sure you guys can hear me okay. I think I'm good. Great. Well, I just want to say, actually following Kim and the data that was presented, I think it'll be a nice complement to talk a bit about part of the work and some of the interventions and opportunities to really elevate the conversation related to early age onset colorectal cancer. So thank you so much, and very excited because I do think, many of the themes and the things we're talking about today are quite global, of course, in terms of really considering the work. And so as noted, Fight Colorectal Cancer is a national advocacy organization that really hinges a lot of work on research advocacy, as well as engaging the patient voice, as well as really elevating that for research advocacy, and really thinking about patient engagement and the improvement of quality of care and survivorship, and really honing in on the early age onset population is something that Fight CRC has done over the last 5 years. And I think as the data and information starts to continue, really thinking about how to help advocate for the EAO population is something that's near and dear. So in front of you, we have a bit of a timeline in terms of really thinking about that advocacy component. Is really about in 2017 as in 15, as these conversations started to really move forward. The publications around the meta-analysis and what we were seeing around data that's showing that this really was an anecdote, that early age onset was a real phenomenon. There started to be more influence at the national U.S. Colon Congress events, advocacy events, and I think groups like Colorectal Cancer Alliance, as well as Fight CRC, do see some of the most activated folks really moving towards advancing the science, as well as the treatment mechanisms are those who are the young, and really collectively looking at those voices, starting to move towards advocating, towards looking at the population screening guidelines that Kim just mentioned, and moving that age from that 50 to 45 with ACS, really being a part of those conversations to really advocate and advance that work, and really just to continue to really think about how do we look at not just the management and the population management, but how are we really looking at studying early age onset and causation moving ahead. And that's something that Fight CRC has been very dedicated to, as you can tell in the last 2019, 18, 2020, is really thinking about convening the research community. So I'm really excited to share some of these initiatives, but I think in terms of really sharing this, I'd like to have Elvis share Julian Geeds, who was part of the Fight CRC advocacy team and who was a survivor and a young early age survivor diagnosed at 26, I think really shares some of the sentiment of Fight CRC and many of the advocates. So Elvis, I'm going to have you run this video for us, and then we'll get into the rest of today's presentation.
I was 26. It was 2015. I was diagnosed with stage 4 colon cancer. There's a lot of ways that having cancer feel defeating, especially when you feel like you're in a losing fight. But when you know there is more than one way to fight, when you know that you can still fight to give researchers and even policymakers the knowledge and the resources that they need to fight cancer in a number of different ways, it makes it easier to face the reality.
And I just want to say that I think that Julian's fight, Julian did pass away, but I do think that so many of the survivors and advocates that are engaged in our work really think about their own battle with colorectal cancer and think about really the management for themselves, but really for so many others. And I just want to say that fighting spirit and that relentless champion hope that Julian really embraced as a survivor is a lot of the work that really propels our work moving ahead. So we know that so many of the issues that are related to early age onset, as Kim noted in the data, really do impact especially a community who are oftentimes caretakers of older parents, of younger children, sometimes are just getting started out. And the differences in terms of what the needs effects and the side effects can be different than older patients. And a lot of those really are thinking about the side effects, the mental and emotional health, financial toxicity, really thinking about the treatment and the burden of treatment when maybe life savings aren't established and people are just getting out of college or buying their first house or have their first mortgage, coupled with something like an extreme medical bill. Career can be a big part of that. But then ultimately really thinking about the sexual health and fertility, which I'm going to dive into a bit. And then ultimately really think about in this day and age of social media and messaging, where we're starting to see, of course, millennials and even people who are younger in that next cohort and group really starting to communicate. How do we look at making messages and really creating a situation in which care providers, advocates, as well as others can really start to message around this. And again, I think this is a great complement because we're getting a bit of a chance to kind of delve into like, what are those issues and how are we managing? So Lisa Johnson is a stage 3 colorectal cancer survivor who is definitely part of the Colon Club. Really, I think shares the dynamicness of many folks. When her radiation forced her out of the ballet, when she, as a ballerina in the work, in terms of looking at her resection and looking at the radiation and the surgeries, really thinking about body image and ultimately her career and her livelihood as a ballerina, but also thinking about sexual intercourse, really thinking about her long-term health as a young woman, as a sexual partner to a spouse, as well as even a mother in the future, really considering these kind of implications for rectal cancer survivors. I think this gives us a real sense, and it's amazing to see someone who's fit and young and a ballerina with an ostomy bag and really thinking about these sort of situations. This is really the reality, of course, that many of our folks know. But really, when we really want to think about how are we managing this, we have to really think like the data that we're receiving about the impact, what it means, and then how we address. So Fight Colorectal Cancer has really created an opportunity for things like mechanisms like podcast series called the Tabooty podcast, where we're bringing out central issues and talking about things that are sometimes considered taboo, in concept. And really, how are we starting to talk about intimacy, the mental health, and security and embarrassment? The idea that a young, thriving ballerina has rectal cancer and is dealing with the side effects from treatment and surgery can be very difficult, especially for people in her peer group. But ultimately, really thinking about those implications and what patients need to be considering, because of course that embarrassment aspect that sometimes isn't really considered as well. So we're really trying to feature more discussions around podcasts, around webcasts, around delving into these specific types of topics that definitely need to be brought to the forefront, and ultimately considering how we also engage the clinical community as well as the patient community in having really meaningful conversations that even in a situation that drawing providers out to talk about these sort of issues where they oftentimes maybe not have done so in the same similar way that they would with older adults. So I really encourage you to check out the series, the Tabooty podcast. There's really so many opportunities for us to really listen and really think about things from the patient side, from the patient perspective, as well as how do we really get the word out in terms of the larger community, having deep conversations about issues that really do impact people. Another sort of aspect of this, and I bring this up as part of the sexual health, but also health and wellness, and I know Kim talked a bit about this as well, is that ultimately looking at that fertility issue. We have 3 different couples looking at people who've been diagnosed. Sometimes before their diagnoses, they've not actually embarked on having a family. Folks that necessarily haven't even sometimes been married. So thinking about preservation of fertility, but also then we also have patients who are diagnosed while they're ultimately in treatment or even at the time of a diagnosis. So these are the types of things that we're really trying to bring to the forefront, so that we can talk about that medical management, we can talk about preservation of fertility, and we can even think about stronger connection to early age onset subclinics that really deal with things not only like fertility in terms of preservation, but when people are pregnant, really thinking about that medical management. So I think the breast cancer community has done some amazing work in this area, but we are starting to see in the United States more and more early age onset clinic systems that really delve into these specific issues. And these are the things that we're really fighting for and advocating for. And again, really thinking about how do we have a strong conversation between providers, patients to address the issues and really elucidate the things that are really common. So I think, Kim shared some great data that more than half of the people under 50 are initially misdiagnosed. We also know that from the time of presentation of signs and symptoms, even through a primary care office, that it can take up to at least a year before people are formally diagnosed. This awareness and really talking about early age onset is something that is definitely leading to guideline change, that it is no longer just an anecdote, but it is part of the phenomenon that we're seeing has to happen with the provider and the patient community. And I think this is something that we're very dedicated towards moving forward, is also with policymakers as well. So I mentioned, of course, with the millennials, as well as with so many of the folks that are young, really thinking about that opportunity for that interface with patient oncology and advocacy. There's really no greater place than to do that through social media. And I do think Fight CRC and a number of groups have done a great job of really thinking of Instagram, the YouTube, Twitter, really Facebook, and how do we really engage folks. With the medical community, we know that Facebook and Twitter could be a great place to tell stories and to share this perspective. YouTube videos and sharing even with very young people, as we know that some of the folks that are being diagnosed are sometimes even teenage folks. These are the sort of things that we really want to consider when we're considering that messaging, as well as that Instagram, to show really the true faces of colorectal cancer and really what's being experienced. And so I just want to really encourage all of you that if you're part of networks, sharing the story, sharing the information, sharing that this is real, the faces, the signs, the symptoms, any sort of mechanism, really social media can be a huge part. And I really think Fight CRC and so many others have really engaged this in such a meaningful way. And a little bit about really thinking about that equitable approach too. I really think that in terms of thinking within the US and abroad, we really have thought a good bit about also the faces and representing in different languages, really making sure to share within the African American, the Latino community, as well as in the Asian American community, people who are those providers, people who do speak different languages, people who are the face, is really going to be critical. We do know that equitable approaches to care and really thinking about how do we reach our LGBT community and others is really paramount right now, and really being sure that we're really representative in that voice is something I think we should all very much consider, particularly as there's a lot of contextual, cultural, as well as even within specific communities, different types of way of messaging, different types of approaches, as well as different types of stigma that exist. So again, really that reaching out and being cognizant of really embracing all of our communities and talking about the health, the wellness is really going to be critical. So I just want to give out a shout out to Candace Henley, who's here with the Blue Hat Foundation, who's done a lot of great work with engaging the African American community, as well as Fight CRC is putting a lot of time and dedication into reaching the LGBTQ folks as well. And I think that, unfortunately, Chadwick Boseman is someone that we're all very familiar with his story. And it's, I think, a critical tale of particularly within specific communities where embarrassment and sometimes not fully being able to share the story because of where you are in your life or what's happening contextually is something that can be quite difficult. But I do know with Chad's passing, we've definitely seen more engagement around the health equity issue, as well as really talking about specific communities and really sharing that early age onset happens to young people and young people within all communities within the US and abroad. And so I bring this up today again because I do think that as we continue to move forward, the early age onset issue is something that we're really going to have to take into consideration, really equitable strategies for all cancer survivors. But as we think about even the complexities that I'd mentioned, even from the financial toxicity to number of the side effects and what we're dealing with, that really we have to be quite astute to really what's happening within those specific subpopulations if we're really going to be effective in terms of providing longer term and quality survivorship care. So I do think that that whole idea of following your gut, and you have to be a relentless champion of hope to use those resources that are at hand and to really share with your community is pivotal. I think that was mentioned before is following your gut, the signs and symptoms. You know your body better than anyone, and really being vocal about advocating for yourself. And if you see other survivors really sharing that perspective, I think is key. Walter Hickman is a stage 2 colorectal cancer survivor, and he often shares, though he was an early stage survivor, he feels that a lot of times as a young man, it is his job and his role to really talk with folks, even those who might be later stage disease, because that's really his mission in life, is that his was caught a little earlier than many, as Kim noted, who are very advanced stage and young folks. And really just sharing that information is power, and it might save someone's life. So the idea of storytelling and really embracing, and through social media and a number of channels, is really quite instrumental. So one of the things I'd like to talk to you a little bit about is Fight CRC has done a lot of work in terms of really looking at engagement of COVID-19 clinical trials and really engaging the provider community. Back in 2019, we did a bit of work around understanding what was happening with the return to care and returning to screening. But what I would have to say is even patients with family history of aggressive disease or colorectal cancer within families were those who were impacted. And I think that we've talked a lot about the impact of the elective procedure bans around the world. But what I would say is that if there's one subset of people that we really have to get into screening and we really need to message to, it's really to patients who have the signs and symptoms, who have the family history, because that's, I think, where we will definitely see that late stage disease if screenings are delayed much further. And so we cannot deny the impact of COVID, and particularly for young people and those who might have hereditary or genetic link. Getting in and really messaging about the importance of screening for the young and taking those signs and symptoms seriously is something that I think can make huge impact in the here and now. The other thing I want to mention is that Fight Colorectal Cancer, and I know others do a lot of great work around engagement in clinical trials. We know that trials oftentimes, especially for disease that can be quite aggressive, and in the young, there's oftentimes an opportunity for people to really engage and to utilize clinical trials that can oftentimes be a first course of therapy, or even later stage, and further lines of treatment can be an option. Fight Colorectal Cancer has really made a huge impact and tried to really message. And really right now, those who are age 35 to 44 years old with the clinical trial finder that is curated and is actually supported by Fight CRC are the majority of the users. So this is something that I think we really have to consider, as well as we can really think about opportunities for engagement and really utilizing the clinical trials as a form of treatment moving ahead, and something that we really need to make sure that is available to our patients as well. So I do have a poll about clinical trials, and I realized I missed one of my polling opportunities earlier. But one of the things I wanted to ask about is, based on your own experience or your interactions with patients, are early age onset patients learning about or participating in clinical trials? So I'll have Elvis and team go ahead and administer that poll, but I'd really love to know from all of you if you are seeing engagement, or as a provider, you're making those linkages, or if you are a patient, if that's something that you've directly engaged in. So we'll give just a minute for that to pull in. And I see my poll list here, and it is open. We have about a 17% response rate. And so far, and then we can come back and look at this later, about 40% are saying yes, and about 60% are saying no. And I think that that's actually quite commendable. I think that this, 5 to 10 years ago, that would have been a much lower number, but that's definitely something that I'd urge you all to really take into consideration moving ahead, is really that opportunity. Okay, so we're going to go ahead and continue on as well. One of the things that Fight CRC has also done is really spent a good amount of time, as I mentioned before, is really looking at convening the science and really thinking about how do we continue to engage the scientific community, not just around population screening health, but also really looking at etiology or causation of disease. And I do think, that it is estimated that colorectal cancer in the next 10 to 20 years could be, or actually even later or earlier than that, will be one of the leading cause of cancer death within the U.S. And I think in many developed countries, this is what we're seeing. But if we are going to be able to manage, I think part of the question is really around that causation. So right now, Fight CRC is really spending a good amount of time in terms of convening the scientists, to really helping advocate and looking at the direction of funding, as well as that research advocate engagement in terms of really helping explore that and really determining where we're going. And then ultimately making contributions to the science based on these meetings and helping set that directive. So in terms of really looking at moving forward, really treatment therapeutics, clinical and trial engagement, really convening the early age onset teams internationally and globally and thinking about shared strategy for research, and really engaging again the research advocates who are either those who are formally trained or those who are also advocating for policy shifts in funding are people that we'd really like to continue to work. So I'm going to talk a little bit about the early age onset working group and a little bit about how that research is being conducted. But part of that is really, I want to just say that Fight CRC, working with Jose Perea and team members internationally, have recently, over the last couple of years, hosted an international conference around the research agenda, much today like Canada, having some discussion about where's the research, the patient engagement, but also really thinking about planned study protocols and how do we really look globally at increasing our reach in terms of research agendas moving ahead. And part of this work really is thinking after these sort of opportunities for international collaboration are keeping work groups together. Some of those are really looking at common data metrics and how are we looking at doing some of the study and the design of data together in terms of common metrics, standardization, specific groups that are working on that, public health approaches, and how do we look at sign and symptom management and work with primary care to make clinical changes, and some practice-based research as well as we're continuing to explore this work, and ultimately really looking at the opportunity for genetic and hereditary work in terms of identifying family members and families faster so we aren't seeing those sort of diseases starting later stage when they could have prevented with earlier screening recommendations. We're working very closely with the National Cancer Institute in terms of their provocative research questions, funding mechanisms, and then with the convening of these international conferences and people who continue to join us afterwards to continue to do some dedicated work and contributions, making sure that that information and those opportunities are funded through the NCI as well as the Department of Defense opportunities right now, and continuing also with the Centers for Disease Control. So one of the things I want to say is I think the advocacy community has an opportunity sometimes to really put those pressure, really pull these levers on areas to make impact. You don't necessarily have to always be the one doing all of the work, but really driving that work is a key piece of the research advocacy paradigm in terms of what Fight CRC and others have been able to accomplish. And I think we're starting to see more engagement and funding in this area, and we're really starting to see a lot of great attention. Let me go back to this one slide here, and I would just also say that the International Research Symposium that Fight CRC will be conducting will be June 24th and 25th next week. We're really excited that CCRAN and other members are really engaged with us through this opportunity. And we're excited to have Canada and to be here to share what we're doing in the US. The social media opportunities, Fight CRC resources really do expand internationally. I would urge you to engage in that. But day one is really going to be some discussion about an opportunity for patients and advocates to interface with the research and medical community. Day two will really be devoted towards the research agenda. But I think there are opportunities for all of you to continue to work with us with this upcoming symposium, as well as the opportunity to access the resources that are available through Fight CRC. So with that, I am going to go ahead and turn it over back to our team. And I just want to thank you all so much for being a part of our work. Thank you to Angie Davis, who's been a fearless advocate for Fight CRC, Reese Garcia, Elsa Waltzine, and many of the survivors and advocates who've been showcased today, but who are also really helping push to move forward the policy and research agenda that I mentioned, and then ultimately to the funders and many who support for the research and the patient education opportunities that Fight CRC's been provided. So thank you so much.